the president of our Caribbean region, who is going to host today's webinar on the topic, Ask Your Questions on Diabetes by Dr. U.N. Das and Dr. Karen Phillips. Dr. U.N. Das is from the United States, and Dr. Karen Phillips is a leading specialist and an endocrinologist from Jamaica. Once again, a warm welcome to all of you for today's webinar on some very important topics about diabetes. And I hope and wish all of you will take the maximum advantage of today's session for your better living. And this is where your journey towards the good health begins. Welcome to this webinar and Medicus one more time. Over to you, Anil.
Yeah, thank you, Varun. And really compliments to Varun for coordinating all of this. Welcome to everyone across the Caribbean. We have some more individuals coming in soon. Just a quick introduction. My name is Anil. It is my great pleasure to introduce two distinguished and renowned doctors. But first, we are EGS Health. We are incorporated and based in the United States with a significant technology hub in India, and working with doctors in Trinidad and Tobago, Jamaica, and across the Caribbean. We have developed the Medicus platform, which you can find in the Play Stores, Android, as well as Apple. And with that, you can consult at reduced fees doctors across the Caribbean and including the United States. So we have one objective in mind, and that is to reduce the cost of healthcare across the Caribbean and to make doctors such as Dr. Das and Dr. Phillips more accessible to patients and citizens across the Caribbean. So with that said, it gives me great pleasure to introduce these two individuals. I will start first with Dr. Das. So Dr. Das, if I were to read his full bio, we'd be here all night. So I'll give you the summarized version. So Dr. Das, also known as Dr. U.N. Das, is a consultant physician diabetologist, clinical immunologist, and rheumatologist. He's the founder and president and chief executive officer of UND Life Sciences. He serves as the chief medical officer and chairman of the scientific advisory board of Asha Nutrition Sciences. Very interestingly, this particular gentleman has received one of the world's highest awards for his contributions to medicine. He has received an award by the Council of Scientific and Industrial Research out of India for his contribution in the field of medicine and science. Dr. Das is an expert, a world-renowned expert on obesity, cancer, diabetes, hypertension, schizophrenia, immunology, and he has dedicated his life to service. It is with great pleasure, and it is indeed an honor for us to have someone like Dr. Das to kick off EGS's and Medicus ongoing webinar series, which we'll be having monthly across the Caribbean at no cost. So Dr. Das will be speaking, and after that, we will have a question and answer session. So welcome, Doctor.
Thank you very much.
I would also like to introduce, and it is indeed a great pleasure, and I first met Dr. Phillips a few months ago. Dr. Karen Phillips is an exceptional daughter of the Caribbean soil. She is an expert in diabetic care. She is a specialist in endocrinology for over 20 years. She is a consultant physician associated with the Kingston Public Hospital in Jamaica. She's an honorary consultant at UWI, where she has been practicing for over 20 years, 18 years specialty in endocrinology, 10 years working in stroke rehabilitation. So she's one of the few persons with this level of experience in stroke rehabilitation across the region. 20 years experience teaching medical students. And she is considered a regional expert in internal medicine, endocrinology, rehabilitation. Dr. Phillips is on Medicus. She is based in Jamaica, and she is available to support and serve citizens across the Caribbean. It is our great pleasure to invite Dr. Karen Phillips to be the moderator for this session. And thereafter, after today, Dr. Phillips has graciously agreed to lead a series of monthly webinars focusing on diabetic care. How do we reverse diabetes? How do we better manage it? And how do we live a healthier, happier lifestyle? So Dr. Phillips, thank you for agreeing to be with us, and I hand over now to you.
Thank you very much, Anil. And I'm very, very pleased and honored to be a part of this very, very important webinar on basic facts on diabetes. And I'm sure that Dr. Das is as well. So welcome to all. Welcome to the persons who are joining. I'm sure you'll learn a lot because we do have an expert in the room. And so Dr. Das was, ably introduced to just now. You must realize that he's quite scholarly. He's well known for his work. He's received many awards. And tonight he will lead us in this discussion on basic facts on diabetes. So I'm going to ask you that if you have questions, you can put them in the chat and we will address the questions at the end of Dr. Das's speech or his talk. And then you, at the same time, we will be putting some questions in the chat for you to answer. So pay attention to the chat, pay attention to the speech or the presentation by Dr. Das. And over to you now, Dr. Das.
Thank you very much, Dr. Karen Williams. I'm very glad to be here. I don't know what is the time now in Caribbean islands, but here in the USA, it is now in the evening around 5 o'clock. So it's quite a sunny day, and the temperatures are slowly shifting from the winter to the summertime. So in this webinar, we are going to talk about very, very basic fundamentals about diabetes. So is somebody going to project the slides or we just go by?
No, the slides are already being projected, Dr. Das. Girish, can you go to the next slide, please?
Yeah, I don't see this slide. I see the introductory slide.
Yeah.
Yeah. Okay, ask your
slide.
questions. Yeah, next one. So we have prepared a few questions, which I thought probably are very important for the people who are participating in this webinar. Just 1 minute, I have to connect it to power plug. Yeah. Okay. So first question would be, what is the definition of diabetes? What do you understand by the word diabetes? Actually, there are two words about diabetes: diabetes mellitus and diabetes insipidus. So most of the time we use only the word diabetes. Maybe whenever we use the word diabetes, that means diabetes mellitus. That means where the blood glucose levels of a given person are being measured, and their levels are used to define whether a person has diabetes or not. The other word is called as the diabetes insipidus, which we are not going to deal with, which is a condition where the blood glucose levels are normal, but they will be losing a lot of fluid from the body. So we are not concerned with that second definition now. So diabetes mellitus, or it is commonly called as a diabetes, is a condition where the blood glucose levels are more than in the normal person. So the next question is, what is the normal levels? So the American Diabetic Association gives the definition as fasting blood glucose levels and postprandial or post-lunch blood glucose levels. Fasting blood glucose are supposed to be below 100 mg/%. That means when you have not taken any food for more than, let us say, 6 to 8 hours or even longer, depending upon your food habits, And at that time, when we measure the blood glucose levels, it should be below 100 milligram per cent. 100 milligrams is the top reading, and it should not cross beyond 100. And post-lunch or post-prandial is 2 hours after eating food, or 2 hours after eating lunch, or 2 hours after dinner. Though we call it as, actually, strictly speaking, it should be called as post-prandial. Prandial means after any food. So, but characteristically, almost all doctors measure post-lunch blood glucose as postprandial, equivalent to postprandial. So that postprandial blood glucose levels should not cross 140 milligram per cent. That means the difference between your fasting and your postprandial or post-lunch blood glucose levels is only 40 milligrams. So, so this is the upper limits of the normal that is defined by American Diabetic Association. So whenever you want to check your blood glucose levels and see whether you have developed diabetes or not, or if you are a diabetic and if you are on diet or exercise, then also you should measure, and levels should be as I defined the fasting and the postprandial. Or if you are a diabetic and you are already taking medicines, either the oral glucose, diet control, oral glucose levels, oral diabetic drugs, or insulin, then also your fasting and post blood sugar levels should be around 100 and 140 milligrams respectively. So this is very important figures that one diabetic should always know and remember and cross-check with his readings. So the next question that many people ask is, okay, if my blood glucose levels are higher than 100 milligrams fasting, or higher than 140 milligrams postprandial, what should I do? Generally, if the blood glucose levels are measured once, and if the levels are abnormal, that means higher than 140 and higher than postprandial 140, then we do not define the person as already diabetic, but we want to recheck or cross-check, because it is possible that, for some reason or other, you have taken your diet abnormally, in the sense you have taken more food than usual for some reason, or you have taken some lot of sweets or some lot of desserts for some reason or other. So we want to make sure that your both fasting and postprandial blood sugars are persistently higher than 100 and 140. Of course, even if one reading is high, then one should be very careful. But we want to make sure that before we give the label of diabetes, that a person is having a diagnosis of disease of diabetes, we want to make sure that it is persistently high. And if it is persistently high, then only we'll call him as diabetic and then advise him what to do about his diet, about exercise, or whether they need the drugs or not. Sometimes what happens, patients come to the hospital on a random fashion. They just come for a regular checkup or a routine annual checkup, and the blood glucose levels are measured. And if he is not fasting and blood glucose levels are measured in a random fashion, to call the person is likely to be having diabetes, it should be more than 200 milligram per cent. Only then we suspect that he is having diabetes, and then he is asked to come again after a couple of days or so in a fasting state to measure the fasting blood glucose levels, and after postprandial, 2 hours after eating food, to check the post-lunch blood sugar levels. So just because one of your readings is abnormal does not mean that you have to get worried and think that you have diabetes, unless it is cross-checked and it is checked both during fasting and post-lunch blood sugar levels, and then it should be persistently higher than the defined normal range. So this is extremely important, because this happens many times. Sometimes it is possible that blood glucose levels are measured for some other disease. You went to the hospital, and so it was measured, and it was found to be higher than 200 or higher than 140 or 160 or 170 milligrams. Then it is generally cross-checked. It is also possible that sometimes the patient comes to the hospital for some other illness. Let us say he has got a fever, or he has got some convulsions or some other condition, and is admitted in the hospital and is being given intravenous fluids, especially 5% or 28% glucose. And then if it is measured, the blood glucose levels may look apparently high. So even at that instance, the patient, once he recovers from whatever illness, for which he went to the hospital, and after he recovers and after he assumes his normal routine activity, then again it should be measured, the post fasting and post blood sugars, and then if they are persistently higher than the normal range, then only we'll suspect that he has diabetes, recheck it, cross-check it, and make sure that it's persistently high. And then he's advised to follow certain guidelines about his diet, exercise, and so on and so forth, to bring them down from the abnormal levels to the normal levels. So, but for everybody, one should remember that his fasting should not be more than 100 mg/cent, and postprandial blood sugar levels should not be more than 140 milligrams. So this is the important range of the blood glucose levels that every normal person and also every diabetic person should remember. And is also important that any person above the age of 40 years, and if there is a strong family history of diabetes, like his parents are diabetic, or one of his parents are diabetic, or his cousins, or his maternal uncle or maternal aunt, or paternal uncle or aunt, and his siblings, or his brothers and sisters, or some close relatives are having diabetes, then also it is important that these people should periodically check their blood glucose levels to make sure that they are also not developing diabetes. It is not necessary just because there is a family history that everybody should develop the diabetes. Because in a family of, let us say, 6 siblings, and if both the parents are diabetic, and if all the 6 brothers and sisters are checked for diabetes, not everybody should be diabetic. Only some develop diabetes and some do not develop diabetes. And this depends on a lot of factors, like their diet, their exercise, then whether they are having any stressful situation or not.
Dr. Das?
Yep.
Okay. I think there are some persons who want to know how will they know if they are at risk for diabetes? So can you just answer that question? What factors or what should they look out for? What should they be checking their blood sugar? When should they be checking their blood sugar?
Previously, we used to say that the patients, any person who is obese, who is having higher weight than for his age and body surface area, or if there is a strong family history of diabetes in the parents or in the siblings, and if there is any symptoms of excess weight gain suddenly or excess weight loss suddenly, say within the last 6 months to 1 year, or if they think that they are having abnormally hungry to eat more and more food, or they are having persistently passing urine more number of times than they used to be previously, then also they should check. So the 3 main characteristics of diabetes are polydipsia, polyphagia, and polyuria. Polyuria means passing urine for a more number of times, or large amounts of urine being passed. Polyphagia means excess weight. So that means you have taken food, but still you feel that you have not eaten enough food and you want to consume more and more food. And then of course, then polydipsia, that means you are excessively thirsty, even though the temperatures in the room or in the atmosphere are not very high, but you feel persistently thirsty, and so you want to take more and more water. So these are the main symptoms with which the person may have. And when he has these symptoms, then he should check his blood glucose levels and make sure that he is not having diabetes. Any other question?
There is someone who is complaining that they've been diabetic for 10 years and the feet are constantly swollen. So they are concerned about the swelling of the feet and what can they do to control the swelling of the feet?
Well, the swelling of feet can occur in many instances, not only just to diabetes or due to diabetes producing some side effects, but it can occur whenever the person has a heart failure, or whenever there is any circulatory problems are there in the lower limbs, like veins and lymphatics are partially blocked, or when there is any infection in the legs. So but if there's none of these other manifestations are there, and if there is only swelling in a known diabetic, the first thing that we want to make sure is that his kidney functions are normal. Because one of the target organs that is mainly affected by diabetes is kidney. So long-lasting diabetes, and if it is not under good control, it is likely to affect the kidney function. And so kidney may start failing to excrete the sufficient amount of urine per day. And then one has to suspect that there may be kidney involvement. And so the relevant investigation should be done that are directed towards diabetic renal disease. Or sometimes the target organ is heart, not necessarily kidney. Diabetes can affect the heart. So if it affects the heart, then the heart is not able to pump enough blood into the circulation, or it is failing. And so then also they will have swelling of the feet. And if there is a cardiac involvement in diabetes, then these patients will have other manifestations. Apart from the swelling of the feet, they may have breathlessness. So they may have difficulty in climbing stairs because they feel breathless. And, and sometimes they may not be able to lie down flat because of the heart failure associated. And they are not able to do the same amount of physical activity which they used to do previously.
So you're saying then that it's very important for them to screen to get their doctors to check them for heart problems. They're diabetic for a long time.
Exactly.
And problems and eye problems.
Yeah, the main target organs that are affected in a patient with diabetes, with a long-standing diabetes, with poorly controlled or not properly regulated blood glucose levels are: one is the kidney, two is the heart, three is the eye, and fourth is the involvement of the blood vessels. Call it as, so they may develop what is called as vasculopathy. So that means the circulation to the limbs, especially the lower limbs, is affected because of the narrowing of the blood vessels. And of course, rarely they can also develop, involvement of the brain in the form of a stroke, or so decrease in blood supply to the brain, and so on and so forth. So these are all called as target organs. And the other system that can be involved in long-standing diabetes is the nerves. So they may develop peripheral neuropathy. They may develop.
A lot of patients complain about tingling and numbness in the feet.
Of the feet, correct. That's right. And remember that the involvement of these various systems for the target organs in the diabetes can be very, very variable. For example, not all patients will have tingling and numbness. They may develop what is called as the cranial nerve palsies. So either third cranial nerve palsy, or seventh cranial nerve palsy, or sixth cranial nerve palsy. So some of the cranial nerves, there are about 12, which may be affected depending upon, which cranial nerve is involved in a particular person. But most common is the tingling and numbness of the legs. And if it is present, then immediately they should go to a doctor, have the consultation, and check their blood glucose levels, whether it is normal or not, whether long-standing diabetes has affected their peripheral nerves. And so the doctor should check your sensation, touch, pain sensations in the legs. Legs are the most commonly involved in patients with diabetes.
Right. Okay, so I think I have somebody asking, in the Caribbean, we have a lot of starchy foods.
Okay.
So in terms of the best way to eat to control their diabetes.
Mostly in countries where the consumption of starchy foods or carbohydrate foods is high, the incidence of diabetes is generally believed to be high. For example, in Southeast Asia, like Pakistan, Ceylon, India, Indonesia, Thailand, all these countries where the consumption of rice is very high. And this rice is also again a polished rice. That means they remove the outer layer that is covering the rice grain, which contains a lot of vitamins, and then it is polished in the machine. And so this white rice consumption is very high. Generally there is a sort of a direct correlation between the amount of starch or carbohydrate one consumes and the incidence of diabetes, but not necessarily be always. That is because the capacity of the starchy food to increase the blood glucose levels immediately or as soon as you eat food is very high. So this is what is called as the the effect of the diet on the blood glucose levels. So that means the glycemic index of these foods is high. So that means the moment you eat food, it is easily digested and easily absorbed. And so because the absorption is fast, the blood glucose levels tend to be a little bit on the higher side. In a
So what is the optimal time and number of times that these patients should be eating each day? We have a poll question on how many times do you eat each day? And we have some responses here. So we have maybe about 38 and 31% of persons eating
correct.
3 or more times.
Yeah, I'm seeing those questions.
Yeah.
Somebody asked whether it is 3 times, 2 times, or 1 time, one large meal, or more than 3 times.
What do you recommend, Doc?
We generally recommend that the eating of food in a day it should be equally distributed and at periodical intervals. In the sense, let us say the convention is to eat 3 times a day. In most of the countries, it is breakfast, lunch, and then dinner. And so generally it is, if it is eaten like that, that is good. So at this juncture, most important to is how much one has to consume per day. So from the caloric value of point of view, a normal person, and if he is not doing much exercise, or it is only doing normal routine work, office work, and most of the time the office work involves sitting, not much walking and all those things, then we recommend that he should take not more than 1,200 to 1,000 calories per day. That means that is the amount of energy that is obtained from the diet. And this 1,200 to 1,400 calories should be divided, if possible, in 3 equal.
In Caribbean will have that in 1 meal, Doc.
No, that is not good. Yeah. So that 1,200 to 1,400 calories should be divided into 3 equal proportions, if possible. Or we recommend that fasting can be the breakfast can be 300 calories, then lunch can be 400 calories, then evening snacks, say another 250 to 300 calories, and dinner another 400 calories. So if you distribute it equally 4 times like that, then it will become 1,400 calories per day. Or if somebody wants to reduce the amount of calories that they take, then they can divide it into 3, 3, 3, 3. So 4 times 300 calories, that again becomes 1,200 calories. There is no harm in if you take less number of calories, but there is harm if you take more number of calories. So
that might be very difficult for a lot of people,
Yeah, I know it is difficult to know to come to calculate the number of calories that they have taken in a diet or at a time. And so the best recommendation would be, what I would suggest, though sometimes it may not look very practical, is you take before breakfast, you check your blood glucose levels. And then after breakfast, whatever breakfast you normally take, you take that breakfast. 2 hours after breakfast, again, check your blood glucose levels. That means fasting and post-breakfast.
Patients always want to know what is their target, what are they aiming for? Where should their blood sugar be as a diabetic?
Yeah, in a
4
diabetic,
meals and 2 hours after meals.
Yeah, the fasting should be below 100. And a post-lunch or post-prandial blood sugar should be below 140. That means normal range. There is no question of giving some concessions there. So you can't say that, oh, my fasting can be 120 or 130, and my post-lunch can be around 180, 190 like that. So no concessions are offered. It should be as normal as possible, and preferably normal, and preferably a little bit less than normal. That means fasting can be around 80 and post-lunch can be about 110, 120 like that. So that means it is a very good control of diabetes. Remember that even if you have diabetes, if you control your blood glucose levels under near normal limits for a long time, you can have absolutely normal life for the next 30 to 40 or even 50 years. I have patients who have been having diabetes since 30 years and they maintain it very well. And so they don't develop any target organ damage. That means no kidney involvement, no heart involvement, no retina involvement, no blood vessel involvement or nerves involvement. So how well you maintain the blood glucose levels is most important.
So about when should these persons start looking out for complications of diabetes? As you had mentioned before, stroke, heart attack, kidney disease, nerve problems.
Yeah, once a diagnosis of diabetes is made in a person, we recommend that they should check their blood glucose levels as as frequently as possible. In the sense, at least once in a month, you check your fasting blood glucose and post-test blood glucose. And once in 3 months, just to make sure that your blood glucose is being maintained under normal limits, is to check their what is called as glycosylated hemoglobin, which gives you an indication about the status of diabetes in the last 3 months or 4 months. So that means so nowadays every doctor measures not only your fasting and post-test blood glucose levels, but also your what is called as glycosylated hemoglobin. It is called as HbA1c. So this is because of the glycosylation of the hemoglobin. And
how often should they be testing the HbA1c, doc?
Yeah, I will recommend every once in 3 months.
Mm.
Yeah, every once in 3 months it should be checked.
And the target that they should maintain? Mm-hmm.
Yeah, should be below normal. That means it should be at least below 7 and at least below 6.5%. So that is very important.
Good, that's very important. There's another question that we're throwing out to the audience about how many hours of exercise, because as your slide is about exercise on lifestyle, how many hours of exercise do you recommend, Doc? Because we're seeing in the chat that half of
I know. Correct.
Yeah.
No, nobody does more than 10 hours of exercise in a day. That is for sure. That means the whole of your day is gone in exercising only, because you sleep for 7 to 8 hours. And then if you do exercise for 10 hours, that means 18 hours is gone, only 6 hours is left. But most important is you do as much exercise as possible within a day. That may be anywhere from half an hour to 2 to 3 hours or 4 hours. And you should also check whether whatever exercise you are doing is sufficient or not to control your blood glucose levels. This is another, which generally many doctors do not recommend, do not suggest. They say, oh, you do exercise for 1 hour or half an hour, or you do daily exercise, or you do only during weekends, and so on and so forth. Then my recommendation is, everybody should try to do exercise every day. And as recommended by the American Diabetic Association, everybody should walk at least 5,000 to 7,000 steps per day. So that means most of the time now many people have smartphones and smart watches, which automatically count the number of steps you have taken in a day. So every person is recommended.
Special type of exercise outside of walking. Some persons want to know.
Yeah, I'll come to that.
Type of exercise.
Best is to walk 5,000 to 7,500 steps per day. 5,000 steps per day will take about 1 hour under normal pace of walking. And that comes to about approximately 2 to 3 miles per hour. That means per day you are walking 2 to 3 miles per day, which is equivalent to 5,000 steps per day, and that will consume about an hour. Okay. And when to do exercise? Yeah, please.
Yeah, we have a question here about somebody's mother who is a stable diabetic for over 30 years, but she's overweight and is arthritic, so she can't walk properly. So she sits most of the day. What would you recommend for her to keep fit?
Yeah, if somebody is unable to walk for 1 hour or half an hour or so, the another thing I would recommend them is to do exercises for the hands, because hand exercises you can do even while sitting. So you take a dumbbell, which is suitable to your weight and your personality and to which you are used to. Say, let us say about 4 or 5 lbs dumbbell you can take and do the exercise for the limbs. So the same 5,000 steps you can do for the upper limbs. Because once you do the exercise for the legs or for the upper limbs, it gives you almost the same amount of benefit. And of course, if you are unable to walk by yourself, you can walk with a walker or with the support. Try to walk as much as possible.
And stretching is also very important.
Yes, yeah. So one has to do stretching exercises, and if somebody can do a floor exercises, or some people do yoga exercises, sitting and doing exercises, flexible exercises, to increase the flexibility of the joints and the muscles. They do. But in my experience, of all the best exercises, if one can do, is taking stairs, going up the I have seen that. I have seen patients. I generally typically ask patients to have a chart with them, walk, let us say 5,000 steps in a day, and check their blood glucose levels. and then ask them to take states. Take, let us say, states of about 10 states at a time, and then go up and down without non-stopping, and then check your blood glucose levels again. And I found that half of the exercises, if even half the time you do exercise by going upstairs, and it will reduce the blood glucose levels much better than the same number of steps you are taking by walking. So it all, of course, depends upon whether a person can do that exercises, that type of exercise or not. It is very difficult to do taking states because you are going against the gravity, and it produces, your heart function should be normal. And, so many people are not used to this kind of exercise. But you can start with walking and gradually increase the pace of walking. And once you are comfortable that you are able to walk well and your pace of walking is good, then you can start taking the states and then see how it helps you and all. Remember that how do you see another thing I have found is that many doctors do not tell, okay, how do you know that whatever exercise you have done is sufficient for you?
Mm-hmm.
The best is to check your blood glucose before and after exercise. So let us say in the fasting state, you have checked your blood glucose levels. Let us say it is 120 mg/person, which is high. Normal is 100 and it is 120. That means 20 mg of blood glucose is high. So now, if you want to do exercise after eating breakfast, then take your breakfast, whatever you are normally used to eat. Then you wait for about half an hour to 1 hour after taking breakfast. Now again, check your blood glucose levels. So what was 120 at the fasting, now it become, let us say, 140. So that means your immediate post-breakfast blood glucose levels is 140 milligrams. Our goal is to bring your fasting to 100. So now if you are able to do sufficient amount of exercise, like walking, for example. So you walk for half an hour, check your blood glucose. Now from 140, it will come to 130. Now again, you walk. You walk like that for every half an hour and check your blood glucose till it comes to 100. So that means if you have walked for about, let us say, 10,000 steps after breakfast, after walking, and if your blood glucose levels falls from 140 to 100, that means that is the amount of exercise you need to bring your blood glucose levels to normal levels after eating breakfast.
So what's interesting then, Doc, is that persons are asking then, so if they exercise and the blood sugar comes down, can they come off their medication? So can exercise cure diabetes? They want to know if, they can ever come off their medication because if they adopt this healthy lifestyle of exercising and eating well.
Yeah, certainly. Just because you are taking oral diabetic drugs or insulin does not mean that you cannot control diabetes with exercise. I recommend for many of these patients is if you are already taking medicines, okay, and if you are determined to control your blood glucose levels just by exercise, then best is you check your fasting blood glucose, then stop your medicines, take breakfast, recheck your blood glucose after breakfast, and now you walk. You walk till it comes to normal fasting levels of 100 or 90. That means that is the amount of exercise you need without drugs to control your fasting. So let us say you are taking either glyciphage or you are taking dianyl or whatever.
So can they come off medication then if they're exercising is what they're asking?
Yes, but they should continue to do exercise forever. Just because it has come to normalcy on one day doesn't mean that you can skip the exercise. You have to continue to do the same amount of exercise.
I suppose the message is that exercise definitely improves your blood sugar control, but there are some people who will need medication still.
Yeah, then even with medication, even with medication, they can do the exercise, except that when they're taking medication and then doing exercise, watch for hypoglycemia, falling of the blood glucose levels. So you have to check.
Somebody asking about weight loss surgery, doctor, and can this cure diabetes if they are overweight?
Yeah, this is what is called as gastric bypass surgery. Actually, technically, it is called as ROIG, Roux-en-Y gastric bypass surgery. And this surgery does not definitely helps. Originally, this surgery was developed for patients who are very obese, so that they lose weight. So in this surgery, they bypass your intestines, and then a part of your intestines is bypassed from the digestive system. And if this gastric bypass surgery is done, they generally lose weight by about almost 30 to 40% in about 6 months to 1 year time. And their blood glucose levels, hypertension, and obesity, they all decrease. And in fact, many patients with who are obese diabetics, they become non-diabetics after gastric bypass surgery. So this is recommended for some, but of course one has to be watchful about whether there are any other complications associated with obesity or diabetes before they undergo the surgery. So the doctor will screen you for all other complications that are present in you, and whether you are a suitable candidate for gastric bypass surgery or not. But there is a lot of
people are very interested about this weight loss thing. They're asking about intermittent fasting. And what do you think about that in terms of trying to control their glucose?
Yeah, intermittent fasting is good. That means the definition of intermittent fasting is you don't take any food for 16 hours. That means, let us say you have taken dinner at about 8 o'clock in the night, 8 p.m. So that means for the next 16 hours, except water, you don't take any food. That means still 16 plus 8 will be, for 8 o'clock you have taken. Next day, 8 o'clock morning is 12 hours. And then another 4 hours. That means you have to eat your lunch or breakfast or whatever food you want to take only after 12 o'clock, midday. That is 16 hours you have to fast and then take the food and then check. That helps because by doing intermittent fasting, it helps in reducing body weight. It reduces
but I guess they would have to be careful about the use of their medication if they're on long-acting, like sulfonylureas also, when they're fasting, because the blood sugar drop.
Yes, you have to be very watchful, because whether you take food or not, whether you do exercise or not, if you are taking medicines, it will work as per its plasma half-life. So when you are doing fasting, if you want to do intermittent fasting, then you better skip or reduce the dosage of medicines and then do the intermittent fasting for about a week or so, and then recheck your blood glucose levels fasting and post-lunch, and make sure that you still need the medicines or not. So you have to be under.
Somebody's asking about gastric bypass, if it's safe for their 80-year-old mother.
Yeah, well, if there are no other complications of the health, like for example, there is no heart disease, there is no kidney disease, and the brain is normal, and the peripheral circulation and other things are normal, and if they are otherwise in stable health, even if they are 80 years, they can certainly undergo gastric bypass surgery, but that has to be determined by your physician. He will check you and make sure that you are, because of old age itself is a risk factor sometimes for surgery, because they're more prone for infections. The healing of the wounds will be delayed, and they may have or may not have some detected or undetected diseases, underlying diseases. So all those things have to be screened for, and then only they have to undergo for gastric bypass surgery.
Right.
Yeah,
we have some more questions here. Somebody's asking about, since we're into our last 15 minutes, somebody's asking about finger pricks and the painful finger pricks and, having to self-monitor their glucose. And if there's any option nowadays for finger prick.
No, because most of the time the blood sugar check at home is checked by using a glucometer. By taking the blood from your fingertips. So you use a needle to prick your finger, and then you take a drop of blood. And
so they're saying they find that very painful.
So one has to be very careful. So every time you check your blood glucose levels using glucometer, use a different finger. Okay, don't use the same finger all the time, because then is very rarely because of the recurrent pricks to the fingertip, it may infect the area and may produce damage to the underlying bone.
Okay, and also there's no continuous blood glucose monitors that can be used where you just
it's called a CGM, continuous glucose monitoring. It's available now. You can put it you can put it to your shoulder or so, and it will continuously monitor blood glucose levels, and it will inform you how your blood glucose levels are being maintained. That is a little bit expensive, but if you get used to it,
not available for everybody. But somebody's asking about Ozempic for weight loss in diabetes. Anything you want to say about that?
Yeah, you can use that because it is supposed to help in losing the excess weight, and then the weight loss itself would help you to control your blood glucose levels. But nothing to beat diet control and exercise to control your diabetes, because they are physiological, And two, they improve your general health, because if you do regular exercise, it not only helps to control your diabetes, but also to improve your heart condition, your blood vessel condition, and your nerves will be better. And exercise will help your brain to develop better memory. And there is a lot of evidence to suggest that if you do like regular exercise, the brain becomes more and more sharper. So the exercise is a very important aspect of control of diabetes. The more
Somebody
exercise you
wants to
do,
know what about home remedies like papaya,
see, except water, whatever you take, they contain calories. You should remember this. So whether you take a dry fruits, you take any other fruits, apple, papaya, whatever it is, except that the glucose content or the carbohydrate content or the caloric content of different fruits are different. Some may have higher calories, some may have lesser calories. But every fruit contains calories. So except water, all other foods you take, consume, they contain calories and they increase your blood glucose levels. So try to stick to a same type of diet throughout your life, or at least after the diagnosis of diabetes is made, and try to maintain it well and monitor your blood glucose levels at regular intervals and make sure that it is under good control. Check your glycosylated hemoglobin, and at least what I recommend is that there are certain sound rules that are to be followed by the patient. Every month, you check your blood glucose fasting and post-lunch. Every 3 months, you check your glycosylated hemoglobin. Every 6 months, you do your blood glucose, blood urea, serum creatine, and electrolytes. Okay. And every once in a year, you check your eye and your peripheral nerves and also a peripheral circulation. So that will be done by the doctor. So he'll check whether you are developing diabetic neuropathy or not, whether your circulation to your lower limbs is normal or not. And then checking eye once in a year for any diabetic retinopathy. How is your vision is going on, and whether there are any chances of developing diabetic retinopathy. And if so, if it is detected at early stage, the interventions would be easier to do. And so that we can prevent further aggravation of the complications.
Yeah, somebody is saying, the doctor said they should limit their water intake to protect the kidney. Is that good advice?
No.
Right.
If your kidneys are normal, no matter how much of water you take, it will pump out the excess water from the body. Only thing is, of course, if your heart also should be normal. If you take more water, and if your heart is not normal, then it will increase the blood volume, and the heart is not able to take up this excess blood volume. The kidneys may be normal, but your heart is not normal, so it is not able to pump the excess fluid intake that you are taking. So similarly, your heart may be normal, but if your kidney is not normal, if you take more water, then the kidney is not able to filter out the excess water to convert it into urine. Then also, it's a problem. So typically, a normal person to take anywhere between 1.2 to 1.5 liters of water per day, or fluids. We call it as fluids, not necessarily water, but it includes the fruit juices you take, other drinks you take, and so total fluid intake. Right. Yeah, 1.2 to 1.5 liters. And generally, our body excretes the same amount of urine. That means your urine output also will be about 1.2 to 1.4 liters per day. Remember that even if you measure your water, there is something what is called as the water loss through the kidney,
right,
through the skin. Okay, this is that means you lose around, depending upon the local temperatures in the atmosphere, you may lose around 500 to 600 ml of water through skin.
Right.
So that means if you have taken 1.5 liters of water per day, and 1 liter will be your urine, another 500 ml will be through your skin.
Yes.
And if it is a summer, and if the temperature is very high, sometimes you may lose as much as 1 liter, 1.5 liters just by sweat.
Doctor, there are a couple of persons who want to ask questions live. So let us hear from one or two of these persons. Or Anil, is there anybody who wants to ask a question live as we round up?
Yeah, okay.
So participants, any one of you can unmute yourself one at a time, and probably will give a couple of them to ask questions, as we are just left with 9 more minutes to end today's session. Yeah. Please say your name and where you're from, and please ask your questions, and keep it short and simple, please.
This is a question. This is Anil. I have a question here. Actually, it's for both Dr. Das and Dr. Phillips.
Okay.
And it has to do with the unique Caribbean people, the lifestyle, the diet, the exercise. Is there any advice for people prone to diabetes? Say, for example, it runs in the family. Given the Caribbean lifestyle, is there any advice, especially for the young people out there, for them to prevent diabetes, if at all it is preventable, if it's hereditary?
Yeah, I think Dr. Das went into that quite extensively in terms of the stress on diet and exercise as a cornerstones in terms of trying to prevent the progression to diabetes.
Correct.
There are lots of studies which have looked at that. Dr. Das?
Yes. Yeah. If somebody is aware of the family history of diabetes, and if he wants to control diabetes or he wants to prevent development of diabetes, the best thing is to control your diet and do good exercise, regular exercise. The regularity is more important than severity of exercise. So if you can't do exercise for a couple of days and then skip exercise for another couple of days, no, you should do exercise regularly, if possible every day, and the same amount of exercise. This is very important. But remember, another thing also is whenever you are doing exercise, you are likely to lose a lot of water from the body. So try to compensate for it adequately. Otherwise, you will develop dehydration. So you should eat enough, you should do enough exercise, take enough water, and make sure that the exercise is the same every day and if possible lifelong. In fact, I suggested to some patients, some of my patients is, some people say that I can't control my mouth, I want to eat more and more food. I tell them, yes, you eat whatever you want to eat, but try to burn all of it. That means if you have eaten excess food, for every excess food you take, you do another half an hour to 1 hour of exercise. Then you are burning the calories you have taken, then it is good. So that is very important. So for example, some of the diabetics, they go for a function, they go for a marriage for function or some parties, and then they happen to consume ice creams and some desserts and so on. Then what I suggest them is, as soon as the party is over, check your blood glucose, how much it is. Yeah. If it is higher than normal, then you do some good amount of walking and recheck after walking to make sure that your higher blood glucose levels has come back to normalcy. So it is all in your hand.
Also important for them to screen as well. So if you have a strong family history, start screening at even age 30 rather than 45, as would be recommended for most persons of Afro-Caribbean or
Actually, because now the incidence of obesity and diabetes is increasing. Previously, we used to say that everybody above 40 years of age should have a screening for diabetes. But now we recommend it that every person who is above the age of 25 years to 30 years should have a screening for diabetes, because the incidence of diabetes is increasing and the age of onset of diabetes also is decreasing. Right. So if somebody is obese.
We're also seeing a lot of young diabetes, so type 2 diabetes, which is what we've been talking about tonight, which really puts up about 90% of diabetes.
That is because they're not
young people now.
That is because they're not doing any exercise. They are obese, and then there is
sedentary lifestyle.
Yes, it's a sedentary lifestyle.
Right. Dr. Das and Dr. Phillips, there is one very interesting question, because when we posted about this webinar online, there is one of these customers who asked this question. But in the meantime, participants, if you would like to ask any questions in live, please raise your hand and our operator is going to allow you to unmute and ask your questions. So in this meantime, so there is this person from Jamaica. So the question is this. So I am type 2 diabetes. How do I control it in my food? Because it's always starchy food in Jamaica. When I read a label, it contains sugar, everything that I has to buy of sugar levels of 2 mg or 5 mg. So I am unable to escape from sugar. So this is one of the questions.
But the important point, and I will ask Dr. Das to chip in on this, is the portion size. So not only just the content of your food, but the portion size is very important. I mean, a diabetic should be eating from a plate, which is like a breakfast-sized plate. Half of the plate should be fruits and vegetables. A quarter should be a lean meat, protein, and another quarter should be a starch. So if you can manage the portions, then you're in a better position.
Yes.
Dr. Das?
Your diet should be balanced diet. That means it should contain sufficient amounts of carbohydrates, sufficient amount of protein, sufficient amount of fat, and also minerals and vitamins. So don't be afraid of sugar that is present in your diet or in any dietary item you take. But if you can reduce commensurate to that, some other item which contains high calories, that will be good. For example, somebody has taken a sweet containing 100 calories. You try to reduce 100 calories from your normal routine diet, like reducing your rice or your lean meat or whatever you are taking. So it should be a balanced diet.
Is very important, because remember that we do need glucose for energy, the main source of energy. So we can't get rid of carbohydrates totally.
Yes, correct. You need everything. It should be balanced diet. Yeah, balanced diet. And whenever you think that you have taken more diet, then try to do more exercise and burn off those calories.
Right. So there is this very important question, and I suppose as we all know, just as a normal patient, or rather a normal person trying to live a healthy life, what's more important for me is obviously how do I prevent getting into this diabetes medical condition. And the next situation is, as we are little aware of diabetes, there is a type 1 and type 2. There is this big question revolving around the world, and we definitely would like to get a sense of an answer from the experts, world experts like you. Is diabetes 2 case reversible?
Yes.
Can a person who is suffering with diabetes type 2 reverse his condition?
Yes, you can, by controlling diet and exercise.
Yeah, so I definitely think it can be controlled.
Yes.
The message that I would send to patients is that if they think that, like I'll have patients who will manage their blood glucose to the point where they can come off medications with diet and exercise, but once they stop dieting and exercising, then it comes right back.
Yes.
So the message is that it can be controlled. I try not to tell them they can be cured, because they think they can just stop doing everything and then it comes back. So definitely, yes.
Right.
Yeah, one should understand that diabetes is not a disease, it's not a abnormality. It is only a lifestyle modification necessary.
Right.
So that means you are eating more food. If you are a diabetic, means you are eating more food than necessary.
Right. I mean, that's a great answer to hear, because this is, it's actually very encouraging to hear those words. And I'm sure that a lot of our participants will take this as an advantage and have personal consultations with either one of you. We have actually shared the links where they can consult directly with you in the chat group. Either they can consult with you using our website or through our mobile application. Gentlemen, we also have a hotline that you can directly call us if you require any help. The number is also displayed in the chat. So there are some wonderful discussions happening around. Dr. Das and Dr. Phillips, any concluding remarks before we hand it over to Anil?
Right. So I will just conclude quickly by saying that the cornerstone of diabetes management is lifestyle. So diet and exercise, as Dr. Das has been saying. And just to remember that, yes, we can prevent the progression or slow down the progression to diabetes, but there are some factors that we have to remember we can't modify, like our race, our sex, and our age, and our family history. And these are things that will put us at risk of type 2 diabetes. So we have to bear that in mind. So persons like that have to be extra careful in terms of monitoring their lifestyle and really being careful in terms of the habits that they incorporate. Dr.
Dan? My suggestion is everybody is prone to diabetes, whether there is a family history or not, and every diabetic is prone to become normal. It all depends on, it all is in your hands. If you can do good diet control, do exercise and lose weight, then you will be normal. Diabetic can become normal. And if a normal person puts on weight and doesn't do exercise, then he can become diabetic. So diabetes is not a disease. It is only a disease of excess weight gain and excess food intake and lack of exercise. If all these three factors are controlled, then you will be non-diabetic.
Thank you so much, Dr. Das and Dr. Phillips. Anil, concluding remarks, please.
Yes. Thank you very much for that. I would like to recognize the presence of Dr. Joy Callender, one of the leading experts in nutrition based in Jamaica. So welcome, Dr. Callender. And also Dr. Dale Maharaj, head surgeon of the Caribbean Vein and Vascular Clinic based in Trinidad. So welcome, doctors. Dr. Das, thank you very much. It is an honor listening to you, for you sharing your wealth of experience. Dr. Phillips, great job moderating. I know you got a lot of questions and you really got us on track at the hour. So I want to thank you, Doctor, for taking the time to moderate this session. And to the participants, thank you very much for joining us. This is what the Medicus team and EGS Health will be doing on a regular basis. Dr. Das and Dr. Phillips are renowned specialists in their field, and they are available for consultations on the Medicus platform, which you can download. I see Varun has shared the links on for iPhone users as well as Androids. The links, this will take you to the Play Store. And you can have follow-up conversations with Dr. Das and Dr. Phillips. So I just want to thank everyone. I would like to thank the leadership of EGS Health. I see Shiva is here, Varun, Girish, and everyone else. I hope I did not miss anyone. So just want to thank you all for having the initiative, for looking after Caribbean people. So just with that, want to close and say that Medicus is here to stay. We are the world's leading telemedicine e-health platform. This platform will allow Caribbean patients to consult with any Caribbean doctor across the region, as well as US-based doctors, for example, Dr. Das. And we have more doctors coming on soon. We have over 24 medical hubs, from cardiology, dermatology, we have GPs, we have oncology, we have second opinions coming very soon. And also very soon for Caribbean patients, we will be having free doctors consultations by one of our international specialists, all in the effort of getting medical care to the people of the Caribbean and making it more affordable. So this is Medicus. You can also find us on medicusapp.com on the web, as well as on any Play Store. So with that, I want to thank again Dr. Das, Dr. Phillips. I'd like to thank the leadership team and to all of the participants tonight. Stay tuned for more webinars as we move forward. Keep well, everyone. Good night.
Thank you. Good night.
Okay, thank you very much.
Thank you all.
Okay,
Yep.
Dr.
Bye.